Hello, this is Dr. Paul Bekkum from All Seasons Full Body Chiropractic Center. Today we're going to talk about whiplash. Basically because what do the roads look like right now? Icy, slippery. I've seen a few fender benders that have happened just the other day here on my way home. I've seen a few vehicles that have been dinged up here as well. So we're going to talk about that today. So if you have any questions, just fill them in the comments and we'll try and get them answered for you here. I have a graphic on the screen here right now, and this has to deal with 6 of the different things that we help people with in the office here. You have the first one there where we're dealing with, the ligaments, the bones and the joints there. How long does it take for some of this stuff to heal here? Ligaments could take up to 6 months to heal after you've sprained a ligament. Nerve tissue, that could take anywhere up to about 3 months, but if it's been damaged, closer to, and let's take the case of whiplash here, the neck. Some people can get some irritation, right where the nerves are exiting out of the spine. And obviously you get different symptoms like numbness and tingling in the arms. Some people can feel hot and cold sensations. They'll call it autonomic phenomena, which would be that numb tingly sensation, the hot and cold sensations, pin prickly sensations. Everybody feels a little bit differently, but that's what can possibly happen if you irritate some of the nerves and soft tissues in the neck when you get rear-ended or hit from the side, even from trauma from sports injuries like tackling and all that sort of stuff. If the ligaments do get damaged, which does happen quite frequently in whiplash injuries, it can take up to 6 months for those ligaments to kind of stabilize again before you can really even start to do some good rehab on it to get it nice and stabilized there. The other thing that we deal with the nervous system there, again, kind of referencing the graphic here. I'm sorry for you people here who might be just getting the audio version. You might want to go back out to our website or our YouTube page and check the graphic out here. We'll have it posted as well with some of the text that goes with this. But proprioception is something where we're basically looking at how your brain and body are connected, so that with the nerves that go out to your muscles, your tendons, your ligaments, your joint capsule, your joint synovium, if any of those things are injured, it's kind of almost acts as a circuit breaker, and you just won't be able to perform certain functions. So we have some tests in the office here that help us pinpoint down what's not working quite right. But proprioception has to deal with position sense, kind of similar to balance when we do a test in the office where you do a one-legged stand, and if you can stand on your foot for 30 seconds, you're doing good. That would be normal. If you can't do it for that long, then we're going to have to work on some balance issues here. Proprioception is best tested then with a one-legged stand with your eyes closed. Now we took out the visual references. Even if we were to plug your ears would also be helpful as well, so you don't even get an acoustic sense of where your body is in space. So there you would be training, if we were to do some therapy and rehab on that, how well your body and brain are connected, which can help out significantly, after any kind of injury, and especially from a whiplash, because that's where your nerves are coming from, is from the base of your brain down through the spinal cord, and it affects your whole body. So other things that can be affected there too, obviously with soft tissue injuries, move over to the next diagram over for circulation. Acute inflammation is usually going to happen for about the first 3 to 4 days. If you have a whiplash injury, you really want to focus on just putting some ice on the areas that are inflamed, that are sore. Ice can be somewhat analgesic. It can help relieve the pain. It'll help reduce the inflammation, and it can take 3 to 4 days to kind of get the acute inflammation. Once it becomes subacute, that's where you can start to look at switching over to heat or using a contrast of heat and cold on an injury there. So typically, if you're going to do a contrast, the traditional way of doing that is by putting ice on first, as well as ice would be what you would use to finish up. So you put ice on for 15 minutes, heat on for 15 minutes, ice on for 15 minutes, heat on for 15 minutes, and then ice on for another 15 minutes to help deal with the swelling that's going on there. That'll help the circulatory system kind of pump blood into the areas that are affected and remove any kind of inflammation that's going on there and help the tissues, you know, heal faster there. The other thing is, if you've torn some of the blood vessels there, obviously you've gotten some bruising or something like that going on, it can take, you know, your body up to about 2 months to help regrow normal vessels back to those areas that have been damaged. So we also have different therapies in the office that we use. For the acute inflammation, we have a class 4 laser that we use to help increase the circulation to those areas to help get the inflammation out. It can help out significantly in reducing the healing time, and also give you a much pain relief there. Usually it's probably somewhere around 50 to 60% with most people for acute inflammation or acute pain type situations. For even the vessel regrowth, we have a therapy in the office called PEMF therapy, or it's pulsed electromagnetic field therapy, which is FDA cleared to help improve blood flow in the whole body. The beamer unit that we use actually helps to improve blood flow to the body by upwards of 30%, and that's to the arterioles, which are, you know, the smallest arteries that are only carrying one blood cell through them. And so that literally is affecting 70% of your body, or over 70% of your body, I should say. So it helps out significantly. I've had patients that have had swelling in their legs of a pitting edema, it's called, and it can actually help reduce that swelling. And I've seen it shrink to almost normal within a couple of visits with people that have had kind of mild to moderate pitting edema. One of the big things, moving over to the next diagram over there, is breathing, where we're dealing with your lungs. It's one of the first things we'll kind of look at here. If a person tends to be a chest breather, they're going to have some issues. They might even have some acid reflux issues. Again, even going with the whiplash type injury there, some people, I mean, they're going to affect the middle of their neck. Usually, you know, anywhere from C3, 4, 5, 6 are the typical areas. 5 and 6 would be the most common, but your phrenic nerve, the nerve that goes down to your diaphragm, which helps with breathing, is innervated by C3 down to C5 on the right side of your neck. So if your neck is affected with a whiplash type injury there, it can affect your breathing, and that's one thing that we want to make sure that we get you doing well again, is so that your diaphragm doesn't kind of lock up there and you don't end up being a chest breather. We want to get you to be an abdominal breather. That will just help long term with you, not only for the injury that you have, which is even long term, making sure you're breathing properly. And if you can maintain these things even after you're done getting treated in the office, it can help you out significantly and reduce different things. Like some people have GERD, and it's actually because their diaphragm is actually weak, and it's just not holding, or it acts as the sphincter to kind of close off the top of the stomach there, so you don't get reflux going back up into your esophagus there. So if that's the issue, that might be a simple fix if it happens to be that you're a chest breather rather than an abdominal breather. So another thing we also want to look at, moving over to the next diagram over for nutrition detoxification, we want to make sure that you're taking some things in that are going to be helpful in reducing the inflammation, obviously, right away. A lot of people are going to turn to non-steroidal anti-inflammatories, which, you know, if you read the bottle, I mean, take them up to 2 weeks, but if you take them longer than that, you're going to end up, you know, having problems. I mean, liver and kidney type issues there. In the U.S., like we had a diagram that we put out on our website here that shows everything there, that in the U.S. there's 100,000 people each year that get hospitalized due to problems with NSAIDs, and there's 15,000, although I've seen some updated information where it says 16,000 people in the U.S. die each year from taking NSAIDs. Those would be things like ibuprofen, naproxen, aspirin, and there's various other pharmacological ones that are going to be prescriptive ones that you take, but they should be just taken for a short period of time. You don't want to be causing long-term problems yourself just because you wanted to get over some short-term issues. Things that you can naturally take nutrition-wise to help deal with inflammation are turmeric, ginger, boswellia. You can use some topical like capsaicin, or it's like cayenne pepper, some heat kind of ointments. Those tend to be really good topical analgesics, the cayenne, so you get some heat, you put it on your skin, or like there's people might use icy hot. I know what we have in the office is well, I'm trying to think what it's called here now off the top of my head. It's like a tiger balm, but it's a heating agent there. But a lot of those, what they're really doing is they're irritating your skin, and what your body naturally does is it sends natural painkillers to the area there to help reduce the pain there. A few of them will have some cortisone or something like that in there that might help a little bit with the swelling, but you're probably not going to absorb too much through the skin. But those can be helpful in reducing some of that inflammation there, but probably wait to hold off and using any kind of those heat type items until probably 3 to 4 days out from the initial injury there. So kind of moving over to the next kind of thing here, looking at muscles and tendons. I mean, if there's been some muscles and tendons that have been injured, those can take anywhere from 10 days up to 10 weeks to heal. Muscles are like rubber bands. I mean, they will stretch, so that's a good thing if you have an accident or something like that with a whiplash type injury, in that they tend not to get injured as much as what the ligaments are, because the ligaments are more like plastic. Once they get stretched, a lot of them, it's hard for them to even go back to their normal size, so then you end up with a joint that can be a bit sloppy, and that's where you're going to have some long-term damage, and might end up having some degeneration or decay in that area there, and that joint's probably just might not ever function normally again. That's one thing that we will also watch with our exams to make sure that if we know that try and get you informed of that as soon as possible. So as far as then other soft tissue repair, some of that stuff can start happening as soon as 2 days and can last up to about 6 weeks to get that. It could be things such as your skin, you get a cut on it there, can heal within 2 days to 6 weeks. Obviously, if you have underlying conditions, diabetes, adrenal problems, thyroid problems, just immune suppression, these time frames get sometimes doubled or tripled though too. So as far as then remodeling the tissue, so literally you have what's called fascia that wraps around all your muscles and all that, and people that will have damage to the muscles or soft tissues there can get some scar tissue that will go not only in the fascia itself, get restricted, but can kind of go down through the muscles if the muscles did get damaged, and you can end up with fascial restrictions, and you'll get pain in places where you might not even been injured, and it'll cause some referred pain. The muscles can develop what are called myofascial trigger points, and what can be really confusing with them is I get a lot of people that come in, again, kind of going back with the whiplash injuries here, you'll get headaches, and it's not that you have problems or your head didn't get injured itself, is that you have myofascial trigger points that are referring pain up to your head, and that's what we need to deal with. We need to trace those back and find out exactly where those trigger points are at so that we can literally get those resolved for you and get the headaches to go away so that you can literally kind of get on with your life and all that. So
wondering, so let's say somebody gets rear-ended, it's that time of year, and they have some acute problems like you talked about, which requires the ice to bring down the inflammation. Is it possible that this is something that can heal on its own, or what are the long-term effects, by not getting treated? What happens to the body if it's not adjusted?
Well, I mean, I guess first of all, if you've had an accident and you're injured, obviously, if you have any significant injury, call 911. Get the ambulance there, get the police there, so they get things checked out for you there. What I've been talking about here today would be something after, if it's a significant injury, you got home, they've checked everything out, it doesn't look bad at all. But the problem is that when people have a whiplash type injury, it's not an injury where you see the damage there. It's deep underneath your skin, And because you literally aren't seeing the injury there, that's where the problem starts to come in here. You tear the tissue, and if it were your skin or something like that, you literally got a cut on your skin. You go in, you get into the emergency room, they stitch it back up, and you'll get a nice fine line scar there. But if you've torn the muscles or the ligaments or anything like that, you don't see it. There might be some significant damage there. Your body's excellent at repairing itself. It's going to lay down some fibrous tissue or scar tissue, people might think of it as, and it's almost like it's laying down a spider web to kind of help, repair that area. Your body's good at repairing itself, but it's just sometimes, if you don't have a positive protein balance, kind of getting back to some of the diet and nutrition type stuff there, you always want to make sure you're getting plenty of protein in your diet. Literally, what would that be for most people? That's about palm-sized piece of protein, whether that be whatever kind of protein you like, beef, chicken, fish, pork, whatever it is, twice a day. Like 2 of those per day would be a minimum for most people. And when you're injured, you actually got to almost double that because your body's trying to repair itself now here. So, if you don't do anything with it, what's going to happen? If you don't kind of increase your nutrition, you don't deal with inflammation, your body's just, it can go wild. Let's look at the worst case scenario here. It can kind of go wild with laying down some of that scar tissue there, and all of a sudden everything just kind of gets locked up. And then if you still don't do anything about it, what's that going to do? It's going to restrict some of the joints. It's going to restrict some of the muscles. You're going to have restricted range of motion. You're going to start to not be able to do things that you'd like to be able to do, like play with your kids, bend over to tie your shoes. There's various different things that will actually even bring people into the office. If you want to continue to even do your normal daily tasks, a lot of people just have a fogginess about them. They can even have a little bit of a TBI or a traumatic brain injury due to the accident, depending on how hard you were hit and the extent of the injuries there. So watching for some of this stuff to just make sure that it's not going on and getting it cleared up. So by not doing anything there, you don't want to just let it go. It's something where you can come in, kind of get it checked out, and make sure that there isn't anything significant going on. If there isn't, hey, you're in and out of here fairly quickly, but generally we can put you through, and we have several screening tests that we do in the office to make sure that we're watching things so that not only can we see what's going on, you'll be able to see what's going on as well here too. So all the testing, and we'll go over that in another video here at some point in time. We'll maybe show you all the different things that happen in the office here. But we always want to make sure that we're getting down to the root cause of your problem and trying to deal with it so we can get it fixed so you don't end up having issues long term, and you don't end up having to go back to fairly reliable Bob's Chiropractic Clinic with a disappearing taillight guarantee. We want you to be able to get on with your life. We'll give you things to watch to make sure that if something does start to come back, you get in right away. It takes a visit or two, and then you're on your way. So I think we'll wrap it up right here. So if you have any questions, you can go ahead and post some comments on the video here. And after that, we'll make sure that we, like I said, address some of the tests that we do in the office here, and we'll maybe go over that on a future video here. And again, any questions, please feel free to call the office, 701-356-0016. Almost gave my cell phone out there. So if you want to call the office again, it's 701-356-0016, or just go out to our website and you can email us from there as well. So hope you have a great day. And if you have a whiplash, don't wait, get it checked.